Hey, welcome to the TheRockinTW channel on YouTube. I am Tony Wells, and today we're in Wenatchee with Joe, who is the owner of
Compassionate Healthcare Collective and Compassionate Healthcare County University.
And how long have you been doing this, Joe?
3 years.
Now tell me, we're in Wenatchee. I'm from Yakima. We've talked to the city council about doing something like what you guys are doing.
Yeah.
How come you guys can do this in Yakima so behind?
Number one, it was very difficult to start this. Speaking to the city council, speaking to the board members, speaking to the people was the key thing for us. A little bit about how we got here. I'm a seizure patient. Now, the city of Chelan and the people in Wenatchee, they know me. Okay, when I started having seizures, I couldn't remember my name, who I was, or what was going on. So I had amnesia for months. I didn't know who my wife and my daughter were. The people in the city seen me, starting to get better, figuring out what was going on. Well, I went over to the city, and nobody else, 3 years ago, there wasn't a single person over here doing medical marijuana. So I went over to the city, and they all knew me, and I was like, hey guys, I'd like to get a business license on the RCW 69.51A. Well, they didn't realize what it was. It wasn't my fault. So they gave me a business license for medical marijuana 3 years ago inside the city limits. Well, when they realized what it was, they had put some issues on me. So what we did was we started speaking to the city council. We needed one person that would show faith to the people, to the city. So we stood up, we went to the city councils, we showed up at the sheriff's department, we went to the meetings, we went to, when the sheriff was doing their police reports, we showed up, we spoke to people, we had talked to the people in the community. There's your basis of what you need, is you need to be, number one, sick, and people need to know that. You can't be a drug dealer. You have to be honestly a true patient. That's where the people are going to follow you. Number two, you have to be honest with your community and with your people. And with that, they're going to stand behind you. And when we approached the city councils and things like that, honestly, we had hundreds of people behind us. When we would go to city council, we would fill the city council meetings. We would bring patients, providers, MS, AIDS, whatever the case may be, leukemia. You bring your sick patients, and you present to them, not as also just only a patient, but as a business person. You present yourself to them as such, like, you have to do so much for your community to go ahead for your community to give to you. That's like our food bank drive. We've raised over 60,000 pounds of food bank food, but all those people from the food bank and all the pastors and people have all written, about what we've done. We've got tons and tons of testimonials about things, so you have to be working with the people, number one. You have to. And then you go from there. You have to have one person that's going to stand up at city council, take the blame, get yelled at, I hate to say it, but be shot at, or whatever the case may be. You need one person that's going to be willing to
be the person out in the front, because that's what I've kind of heard here in the Wenatchee area, that you were the person out front, and now there's a couple other people doing what you're doing, but you kind of took all the hits for everybody else in the beginning.
Yeah, I did, but somebody, like I said, has to stand up and say, this isn't right, this is how I feel, this is the way it should be. Legislation was put into place. The reason that legislation was put into place, so patients like me, patients like you, providers like him, so on and so forth, we could stay within state compliance. That RCW was put into place for a reason. Okay, now, with that RCW, somebody has to stand up and say, hey, RCW 69.51A is for this, this, and this. Me as a patient, me as a person inside my community is allowed by state law these issues. So I as a patient can go, throw my meds, possess a pound and a half of medication, 15 plants. That's my state right. The RCW allows me that. Now, the states and the cities are trying to supersede that, but now, you have to be persistent. You have to show up to city council meetings. He has to show up to city council meetings. Whoever it may be, you need to bring and in this area, it was very, Yakima, you guys are fighting a serious battle over there.
Oh yeah.
But the police and the community, they're running all over you because nobody is standing up and saying, you know what, this shit ain't right. There needs to be a group of you, all of you, everybody, not just one, but everybody. Because if you don't stand united, you know what you have? This, just one.
Yep.
And that's all you have. So get every last person, get your asses out there. If you're in Yakima, don't be retarded. Get out there, do what you need to do. Because if not, you're going to be in a situation where you're left, I hate to say it, but you're left in last. And you don't want that. You don't need that. You need to progress the medication and the education in every aspect of every life.
So So yeah, if you're in the Yakima area, man, support us and help us out.
Yeah.
And Joe, hey, thank you for your time today. I appreciate it.
And you guys can call us, like I said.
Yeah, what is your number? If I want to get a hold of you, or I want to talk to you in the Wenatchee area, or I need help, or I want to get involved, how do I call you guys?
Well, you can reach us either by email at chccollective@gmail.com, and or you can call our location, which is 509-888-0504, or the new market number, because we're doing the farmers market here also now, is going to be 509-888-0506. So that line is going to be transferred from my grower line upstairs.
Yeah, so if you're a medical patient and you're looking for meds in the Wenatchee area, definitely come and check out their farmers market, because upstairs there's a whole lot of people. And then definitely check out Joe's business. But
yeah, we're using the university, about to start coming up. You know, education leads to better medication. Period. Which better medication leads to what? Better lifestyle every time. You know, so sweet. Get your asses out there, Yakima, because if not, we do this.
Perfect. Hey, thank you very much, Joe.
Yeah, not a problem.
All right.